Unit 12. The gastrointestinal system. A. Examination of the abdomen. Here is an extract from the textbook description of how to examine the abdomen. Note, if the abdomen is distended by fluid or gas, 2% of a fluid can be confirmed by demonstrating shifting dullness, percuse or tap, first with a patient lying supine, flat on their back, then ask the patient to lie on a side and percuse again. If fluid is presented, the dull note here on percussion moves. Palpate each region, feeling for tenderness. The pain when touched or massaged, palpable enlargement of tissue. Note also any warding or rigidity shown by contraction of the abdominal muscles. Warding may be due to tenderness or anxiety and can be reduced if the patient is persuaded to relax. Rigidity, however, is constant and is due to peritoneal irritation. Rebound tenderness is pain when the palpating hand is suddenly removed. It is a sign of peritonitis. Listen to the vowel sounds. The faces. There are several words for the faces. Doctor sometimes says, there was blood in the stools. Have you passed black stools? Bowel movement is used to refer to defecation. Have your bowels moved today? Have you had a bowel movement today? Bowel habit is a medical expression meaning the pattern of defecation. Have you noticed any change of bowel habit? How often do you open your bowels? Are you going to the toilet more often than normal? Change in the bowel habit could have constipation, hard, infrequent stool, or diarrhea, frequent soft or liquid stuff. Normal stuff are brown in color and semi-solid or formed. The consistency or degree of hardness and softness can be shown on a scale: hard, formed, semi-formed, soft, liquid, watery. The color can vary from black due to altered blood as in melania to yellow, gray, or even white. Melania stools are often described by tarry. Like tar, the black stick substance is used in road making. The stool may be red when fresh blood is present. Blood that can only be detected with a special test is called fecal occult blood, FOB. When there is a high fat content of a stool are palpate and are sometimes described as clary colored stools that are large in volume are described as bulky. A bad smell is described as foul or offensive. Unit 21. Gynecology. A. The female reproductive system. We have the womb, ovary, net womb, fallopian tube, vagina. B. Menstruation. A period is the common name for a menstrual period. The onset of menstruation is known as menarche. The last menstrual period is common abbreviated in doctor's note LMP 252 ago, means the last menstrual period has 2 weeks ago. The menstrual cycle, or length and frequency of period, is usually written in the form 4/24/28, which means lasting 4 days and occurring every 28 days. If a period lasts more than 4 or 5 days, it can be described as prolonged. Then turn heavy periods means excessive blood loss, menorrhagia, often with passage of clots, coughed blood. The term period pains means dysmenorrhea or painful menstruation. The time when a woman stops menstruating, normally at the age of 50, is called menopause or climacteric. In everyday English, it is known as the change of life or simply change. Symptoms of the menopause are include cold flushes, sudden sensation of heat, and night sweats. A gynecological consultation. A gynecologist is taking a 30-year-old woman. Gynecologist. Patient. Are your periods regular? Yes. How often do you get them? Every 4 weeks. How old were you when you started to get them? About 12. When was your last period? A week ago. How long do the periods last usually? 4 or 5 days. Would you say they are light or heavy? Light. Do you get clots? No. Do you get period pains? Not really. Is there any discharge between the periods? A little. What color is it? White. C. Contraception. For women, methods to prevent pregnancy it includes the oral contraceptive pill, known as the pill. The diaphragm, and the intrauterine device, IUD, or copper coil condoms are available for both men and women. Unit 22. Heart circulation. A. Shortness of breath. Shortness of breath or breathlessness is dysphonia. At first, this is caused by exertion. Physically activity such as climbing stairs, but in several cases it may be present even at rest. A patient who is breathless with lying flat, for example in bed, will tend to sleep raised up on two or more pillows. The abbreviation SOBOA stands for shortness of breath on exercise or on exertion or before. Patient says, I get terribly short of breath climbing stairs. Doctor can ask, how many pillows do you sleep on? B. Heart rhythm. The normal resisting heart rate is 65 to 75 beats per minute. In athletes, it may be as low as 4 beats per minute. In extreme athletic activity, the heart rate is go as high as 200 minutes 200 per minute. The heart rhythm may be regular or irregular. In an irregular rhythm, there may be early beats which interrupt the regular rhythm, or the rhythm may vary with respiration, or it may be completely irregular as in fibrillation. When patients are aware of irregularity, they describe the symptoms as palpitations. Case 4. A 22 years old student has admitted to hospital with a long history of heart problems. She had been increasingly tired, with shortness of breath on exertion, orthophonia, and palpitations. A mitral valve replacement has been carried about 3 years previously, and this has established the symptoms of heart failure, but was followed by episodes of atrial fibrillation, which had been particularly severe for 6 months before admission. C. Heart failure. Heart failures occur when the heart is unable to maintain sufficient cardiac output, the amount of blood pumped by the heart each minute, for the body needs. It may involve the left side of the heart, the right side, or both. In left heart failure, the main symptoms is breathlessness. The symptoms of the right side failure include peripheral edema beginning in the feet and ankles. This is known as pitting edema. If when a finger is pushed into a swelling, it causes a small depression or pit. Here we have aorta, the aorta, pulmonary artery, pulmonary veins, tricuspid valve, mitral valve, septum.